Okay, so this week we're going to be talking about the social science research process, and this is part one, the history of science. So if I were to ask you, what is public health, every one of you would probably give me a different definition. For simplicity's sake, we'll use the definition used by the World Health Organization, which says, public health is the science of preventing disease, prolonging life, and promoting health through organized community effort using an evidence-based approach. Note the promoting health aspect of this definition. What does that mean? Well, it means that we're just as concerned with the quality of life as we are the prolongedness of life. After all, if you were to live to be 100, that would be great, but if the last 30 years of your life you were on life support, it may not be that great after all. The last part of this definition says community effort through evidence-based approach. Now, this is much different than what we see with doctors in the field of medicine. So let's think about what that is. So public health is concerned with the health of populations, unlike the field of medicine, which is more interested in treating, preventing diseases in individuals. So the focus is very different. It's also that our research doesn't always involve the direct interaction with people. So for example, my own research tends to use secondary data sources. The last aspect of this is that while doctors may be concerned with understanding like the history of your parents and grandparents, they aren't usually as concerned with the role of your environment or other structural factors in your life. What do I mean by structural factors? Well, things like the role of your workplace or your environment or other factors that could have influenced how your health turns out. And this is all part of the life course perspective. Now, let's just think about the roles of clinicians. So a clinician is a medical professional who provides direct care to patients or clients. This includes physicians, surgeons, nurses, midwives, and other caretakers. And they work in a variety of fields, and all of them have some form of direct contact with people in their role. But public health scientists aren't really interacting with people in the same way. So if I'm looking at how efficient a heart monitor is, am I going to go to the hospitals myself and interact with every single patient that's using one? Probably not. Instead, I'm going to take the data that the hospital has collected and I'm going to analyze that. Now, it is really important to make this clear, but that still is human research. Humans are the basic unit of analysis in most of these cases. It doesn't matter if we're investigating a treatment, a cure, a medical device like a pacemaker, any of that. If we are investigating something that interacts with humans, humans are the basic unit of analysis. Now, much of our research is indirect, except when it's not, but we'll talk about this more later in the semester. Now, since the population is the focus for our analyses, this means that we are working to understand every factor that can shape the health of people in those populations. We call these factors the determinants of health, and they include biological factors, political factors, social factors, environmental factors, basically all factors internal and external to the individual. And more, we are focusing on the upstream factors as the root cause of health disparity. So this means things like the social structures like gender and race and religion and how those things impact our health in a way that our individual decisions cannot. So for example, obesity seems like a very personal choice and a very personal decision. However, if you live in a neighborhood that has no grocery stores, no fresh fruits and vegetables, no public trans, you don't own a car, but there are 3 convenience stores that sell things like soft drinks and other processed foods that are high in salts and high in fats, are you going to walk the 3 to 4 miles to the closest grocery store to buy healthier foods, or are you going to make do with what you have in your neighborhood? When we start looking at these upstream factors, like where do you live, we begin to see that there are many factors that have much more impacts on us than our personal choice to have a hamburger that day. Now, in public health, we monitor the health status of communities. We help prepare for and deal with environmental hazards like hurricanes or flooding. We provide health education on topics related to safe sex, getting vaccines, or brushing your teeth. We also support communities in their efforts to provide healthcare services by providing vaccines at no cost to communities. And we develop policies. So if you think about FSU, we are a policy-based public health program. And more, we are helping to develop our students to go work for legislatures in order to write policies that may benefit the health of our citizens. And in public health, we strive for the equitable distribution of health services. Now, public health research often involves assessing the needs of a population and their capacities, or what they have the ability to do during an emergency, designing, implementing, and testing interventions, evaluating programs, projects, and policies, and that'll be a major focus of this course. And we draw from a variety of fields, most predominantly sociology and our subdiscipline demography, psychology, anthropology, economics, biology, nutrition, genetics, law, and medicine. And keep in mind, I'm a medical sociologist. Now, research is the search for knowledge. The primary purpose for scientific research is to answer questions. And a lot of those questions in this class will be concerned with: why do some programs succeed while others fail? Why does some messaging work at encouraging the adoption of an intervention while others fall flat? Why do people know how to protect themselves from STIs yet fail to do so? Why do chronic diseases go untreated and unmanaged? How do communities mobilize to solve persistent healthcare problems? And any other questions that you might think of that we would want to know. All research goes through a vetting process. This means that we test the research with other reviewers in order to make sure that bias is limited and that the findings actually are accurate. Because if we accepted research that was based only in the researcher's personal biases, such as their anecdotal experiences or subjective beliefs, we would end up with research that is selective, biased, and inaccurate. This goes to things like Andrew Wakefield, who made the false claim that vaccines cause autism because he used a sample that he had cherry-picked to make sure he got the results that he wanted. So to the contrary, we have to create a systemic way to search for knowledge. And this is why science has such rigid guidelines for research. There is a process. This keeps the research planned, focused, and managed. Now, there is some debate over whether social science is a science, or even if it's desirable to be even labeled as such. And much of this debate is held by my fellow sociologists. But there are three factors that set social science apart from opinion and conjecture. First, social science is systematic. This means that there is an action plan to the research. People aren't just making things up. They are following a set of guidelines and rules as they perform the research. It also involves data, which means that it is empirical, and we'll talk about what that means in just a second. It also involves analyses. We are using this data to make inferences and draw conclusions for larger populations. All of this kind of sounds like science to me. We can define social science research as the systematic understanding of social facts or phenomena, generally in relation to events, statuses, or conditions. So think about disease conditions like COVID-19. Social science gathers information about the social world. So who's living in it, what do they do for a living, what are their races, their genders, their ages, and so on. And then it helps us to interpret that information in order to make decisions on courses of action or develop new knowledge. Social science is also concerned with cause and effect relationships between social problems, disease states, and other events. And it attempts to answer or solve those social problems. So like the natural sciences, the goal is to discover new facts or verify and test old facts. But the main difference here is that social science is focused on humans and human behavior. And in addition to human relationships with natural laws, this gets muddy. This is why Neil deGrasse Tyson said physics is easy, but sociology is hard. In social science research, we are trying to find causal connections between human activities and the natural laws governing them. And we are aiming to develop new tools, concepts, and theories, which would then facilitate reliable and valid studies about human behavior and social life. Social research follows the norms and tools of natural science, which emphasizes validity, reliability, and verifiability of phenomenon studied. Now, the rigor in social science research implies objectivity, neutrality, and empirically produced evidence. Specifically, this refers to empiricism. So, before I define what I mean by that, let's take a moment and walk back in time. The birth of science can really be linked back to the Enlightenment period. During the Enlightenment, we saw a point where humans were reaching a leisure class, where people had time to sit around and think a little bit more about the world that they lived in. And so during this process, we decided that we as humans could understand the world around us. And to help us do that, we developed 4 basic concepts. These 4 concepts were called rationalism, empiricism, skepticism, and subjectivism. Rationalism says that if a premise can be doubted, you have to find the conditions under which it would be false. This is the whole foundational concept of science. This is why in science you are never trying to prove yourself correct, you are always trying to prove yourself wrong. Empiricism is the idea that you can observe and personally witness the event that you are studying. Skepticism was meant to challenge dogma with a critical eye, because at this time there were a lot of influences, such as the crown and the church, that were telling people this is how the world works. And so the early scientists were challenging those dogmatic views. Lastly, and this also has to do with the church of the time, the scientists of the time began to view us as being a subjective universe rather than a God-centric universe. So in subjectivism, we view humans as morally free, having dignity and having the capacity to be perfectible. Whereas in the other views, God would be at the center of the universe and everything would revolve around him. In subjectivism, humans are at the center of the universe and everything revolves around us. Now, when we take a couple of those ideas, specifically empiricism and rationalism, we create something called positivism. This is a type of scientific inquiry that helps us make the belief that science can be used to understand all truth. Now, the Enlightenment itself was a scientific revolution that led to the emergence of a new epistemology. Before, we can talk about more about the Enlightenment or social science, let's actually define a couple of words, beginning with epistemology. Epistemology just means the study of the nature of knowledge. It's concerned with what does it mean to know, how do we create knowledge, and who creates that knowledge. Another term that I want you to know is catalyze. This is the process of beginning, or to cause something to happen, to initiate. Another is normative, or should. This is the standard, what is expected, what we know should be there. Now that that's done, let's consider the shift from rural to city life. When we look at how people organize themselves, we see that up until the early 1800s, most people did not live in cities. And so you can see the population of London in the early 1600s, about 200,000 people, but by 1801, it had hit almost 1 million people. And then by the early 1900s, it was over 6 million people. So the reason people started to move into cities was that we began to industrialize. This brought new opportunities for people to gain wealth, but it also brought new diseases. These diseases impacted people because of the close proximity that people were living to each other, because they lived in very close quarters, whereas in rural environments, they may not have neighbors for miles. In cities, their neighbor was above and below them and beside them. So this brought new challenges and it revolutionized the public health field as we know it. So the Enlightenment shifted us from this pre-modern world where we were subject to kings and queens and to religion into the modern world where we decided we can make decisions for ourselves. This saw the rise of democracies, the rise of nation states, the rejection of kings and queens, the rejection of religion as the ruling factors, and it led to a lot of our early scientific understandings. But eventually, we moved into a postmodern world, and this is where we are today. In the postmodern world, changes have affected meaning, identity, understandings of what is reality, and how power is exercised. So if you look back at the pre-modern world, it was this idea that God made everything, so therefore that's all that matters. And people were okay with that, because if you worked 6-7 days a week and someone said you could have a day off if you went to church and listened to someone talk about why the earth was made, people were very willing to take that because it gave them a day off from work. But eventually we moved into a point where more people had what we would call a leisure activity or leisure time, where people could sit around and they didn't have to work quite as hard as they used to. In this modern world, we began to think a lot more and we decided we can find absolute truth. But as we all know, it's almost impossible to understand absolute truth about any subject, which has led us to the postmodern world, where now, with a device like a cell phone, I can find anyone who believes the same things that I do, which leads to a rejection of evidence and the rejection of the scientific community up until this point, which is why you have so many people who are anti-vaccine. But what does this even mean, and why is it even relevant? Well, when we think about what changed between modernity and post-modernity, we saw the rise of mass media during modernity with newspapers and magazines. But as we moved into post-modernity, we saw the rise of social media, platforms like TikTok, Instagram, Snapchat, Facebook. We also shifted to being a consumer society that was heavily invested in information technology. And this also led to extreme rationalization and extreme empiricism. This is why you have groups like flat earthers who are trying to launch themselves into space because they cannot trust the scientists who are telling them that the earth is spherical, and instead have to see it for themselves, because empiricism, the concept is that you witness it, that it is observed, and instead of trusting the observation to be made by those with training to do so, we have to observe it ourselves. And also extreme rationalization, that we have to find every reason to doubt what is said, and a lot of that has to do with early postmodern thinkers like Foucault, who said that knowledge is generated in the service to someone in power, so we cannot trust the things that we're taught. Okay, this is enough of this. We're going to return to the social science research part in part 2.